Tonight on your Health Watch, a family's battles to get the experimental treatment that could save their young son.
Also, news of another risk factor for stroke. Here's KCAL-9 health reporter Lisa Sigell. Lisa?
Kent, Susie, tens of millions of Americans with slightly elevated blood pressure could be at increased risk for stroke. The report in Neurology shows any blood pressure reading above normal may increase the risk by as much as 66%. Now, blood pressure between 120/80 and 139/89 is considered pre-hypertension. High blood pressure is 140/90 and above. Doctors currently recommend a low-sodium diet and exercise to treat pre-hypertension. One cardiologist says more studies need to be done to see if medication should be an option.
I think that if you were to consider pre-hypertension, now again as a risk factor for stroke, then you are dealing with millions of Americans.
It is estimated 31% of adults in the U.S. have high blood pressure. Another 30% have pre-hypertension. Well, the maker of OxyContin says it's completed testing of an abuse-resistant version of the painkiller hydrocodone. Purdue Pharma says it plans to submit its pain reliever to the FDA later this year. The tablets are designed to prevent users from crushing them for snorting or injection. Now, this development could cut into the sales of the new painkiller Zohydro, which has been criticized for lacking similar safeguards. Well, what a story this is. A Virginia boy with a deadly infection is soon expected to start a potentially life-saving treatment. His family fought hard for him to have access to an experimental drug, and now they finally got their wish. 7-year-old Josh Hardy will get the experimental drug his family has been fighting for. Oh my God. His mother, Amy, broke down in tears when she heard the news.
Such a relief. I mean, we still have a long road ahead of us, but gosh, to get this out of the way and for it to be as successful as it looks like it's been is huge.
Josh has been battling cancer since he was a baby. His weakened immune system left him open to a viral infection that now has him close to death. His doctors recommended he take the drug brincidofovir, but it's still in the experimental stage. And the manufacturer, Chimerix, denied the request. That's when the Hardy family launched a social media campaign to put pressure on the company.
I went on Facebook and said, does anybody have any influence?
While Josh's story spread, Chimerix quietly worked with the FDA to fast-track a new trial that would include Josh.
There's no doubt that Josh's story helped accelerate what we've been able to accomplish.
His family says they now have hope he will overcome this latest medical crisis.
I have a lot of faith that he is going to make a full recovery.
And 19 others, like Josh, will also be part of the trial. And this drug has been in development for 14 years. It is expected to be another 2 years before it's available to the public. With Health Watch, I'm Lisa Sigell, KCAL-9 News.